Hello, this is Dr. Joseph Chameleon. In this video, we will have a look at a very common problem, the loss of a lateral incisor and its replacement using a keyhole mini implant. Now, this particular patient is an entertainer in Australia and had lost this tooth, which had been previously root-filled, had a post, and the crown had led to a root fracture. He was given a partial denture by his dentist about a year prior to him visiting my surgery. And of course, the large acrylic base plate that carried this single tooth was not acceptable for this patient as a long-term solution. Nor was the idea of a bridge requiring further damage to adjacent teeth. An implant in the form of a conventional implant was not something he wished to consider because he'd been advised that a graft would be necessary. When assessing the ridge, you can see that the labial plate is slightly deficient, but still with plenty of ridge width, alveolar width, to carry a mini implant. Here's the implant in place, centered between the adjacent teeth and between the labial and palatal plates. A very straightforward insertion without the need for flaps, without the need for large osteotomies, and without the need for suturing and a lengthy healing period. The temporary crown is created and cemented at that same visit, allowing the patient to leave without the partial denture. Of course, at that first visit, we take the impression as well, send it off to the laboratory with our shade guide, and make sure that the crown returns within a reasonable period of time, usually about 2 weeks in this case. Here's the ceramic crown, and there it is, cemented onto the foundation, onto the implant, within 2 weeks of placement. Here's a close-up of the crown. You can see it's a ridge lap design, and it has the ability to function beautifully for a lifetime. In fact, this case was performed in 2004, and you can see the soft tissues are beautiful in contour, lovely in color. The floss is engaged in the interproximal spaces in the usual manner, but instead of stopping at the gingival crevice, as would be the case with a natural tooth, it's continued another millimeter or so apically to come in contact with the implant itself and rid the area of plaque very successfully. This case, as I mentioned, is now over 10 years old, and you can see the contours are beautiful. The laboratory model clearly shows the implant, the actual contour of the implant prior to cementation of an abutment. The abutment is fashioned by the laboratory, and the crown is made to fit precisely on top of that foundation. Here's the abutment ready to be cemented onto the foundation, onto the implant itself, and there it is in situ. A far better foundation, a far better method of replacing a missing tooth than a large lump of acrylic. As you can see, the unnatural contours of the acrylic sitting on the palatal soft tissues has now been replaced with a single crown, which can function far more naturally, far more normally than any other replacement. The adjacent teeth are left intact, the labial deficiency is left as it is, there is no cosmetic problem associated with that, and the palate is left free of any acrylic coverage. This is an ideal way for you to help your patients with the replacement of single missing teeth in 2 short visits. The first visit takes about 40 minutes for placement of the implant, take the impression, fabricate the temporary crown, and cement it. And the second visit, a couple of weeks later, only takes about 15 minutes for the actual cementation of the crown. I hope you enjoyed this short presentation. Keep an eye out for the next video, which will show you the replacement of a lower molar using keyhole mini implant dentistry. Thank you for watching.